the biggest question that I am asking myself is, do I regret it? Do I regret becoming a doctor? Because there's a lot of things that I've experienced that, makes me wonder, would life be a little bit different if I was not a cardiologist, or if I was not a doctor at all? So the first part is, how long does it take to become a doctor? How long does it take to become a cardiologist? To become a doctor requires 4 years of undergrad and then 4 years of medical school. Boom, you're a doctor. But to be able to practice in the United States of America, you need to do a residency, and that residency can be in whatever you love during your medical training, whether it's OB, family medicine, internal medicine, anesthesia, surgery. So those residencies are as little as 3 years, but can be as long as 7 to 8 years, which are neurosurgeons. With that, you can also do extra training, which is known as a fellowship, and that's what I did. I did 4 years of medical school and then 4 years of residence, 3 years of residency. So I became an internal medicine doctor. I then wanted to become a cardiologist, which is an additional 3 years. In the world of cardiology, you can even go further. You can be an interventional cardiologist, heart failure, electrophysiologist, focus on imaging, congenital. So there's a lot of different things that you can do. And with all of this, man, sometimes you just have to look back and wonder if all this training, 14 years to become a cardiologist, 11 years to become an internal medicine doctor, was worth it. And absolutely it was. It was. I think with it has to come the stress of the job itself. It is extremely stressful. There's a lot of things that sometimes I wonder if I'm strong enough to continue to do this, but was 100% worth it because my desire to become a doctor didn't change, and it wasn't because of money. It was because being able to help somebody, to help people. Initially I thought I was going to be an orthopedic surgeon because I wanted to help people who have dealt with broken bones. Unbeknownst to me, I would be dealing with people who have broken hearts. But broken heart syndrome is a thing, so I can talk about that later if you guys want to know about it. But why do I love being a cardiologist? It's just the ability to do a little bit of everything. I do inpatient medicine, outpatient medicine, imaging, and those imaging can be reading EKGs, it can be reading echocardiograms, stress tests, maybe CTs in the future, cardiac CTs. So there's a lot of just variability in it, and then you can choose whatever lifestyle you want later on. If you find that you don't like inpatient as much, don't do inpatient. If you find out that you want to do more inpatient than anything, then be a cardiac hospitalist where you just do 7 days in the hospital, 7 days at home. There are some places that provide that option for you. So the variability of it is the biggest thing. It's one of the best things about being a cardiologist. What else? I knew that I really wanted to do it because I kept on reapplying. I didn't get in the first time, second time. I reapplied 3 times, and then I finally got in. So I knew that this was something that was worth the giving up the money of a hospitalist, which is minimum 300. Sometimes some places up to 600-700K a year. So giving up close to $1 million in 3 years to become a cardiologist, 100% I would do it back. I would do it again. I think just when you're finding a job that you do and you love, it sometimes doesn't feel like work. I do have a lot of stressful patients. I do have a lot of stressful days. I do have a lot of stresses outside of work, but going to work and the interactions that I have with my patients, but also with my nurses, with the techs, with the secretaries, with everybody, I enjoy going to work. But I also know that I enjoy going to work because I'm in a place where I'm able to kind of tweak my schedule to how it seems fit for me. So for my outpatient days, I typically start at 8:30 or 9 o'clock. And I have the flexibility to do a little bit of both. There's nothing better than being able to work out in the morning, or being able to drop off my kids at school and then go to work. I remember the days being younger that we had to take the school bus because my parents, had to be at work at a certain time and weren't able to drop us off at school. And now my kids are going to have that option for me to be able to drop them off, or if they want to take the bus system. So I enjoy that flexibility in my job, and where it's what it's given me to be able to start when I want to, understanding that means I'm just going to have to either see a lot of patients quickly or finish a little bit later. And a lot of times it's usually the latter. Usually finish between 4:30 and 5 o'clock p.m. What else do I love? Man, I can just keep on going. I think the camaraderie amongst my attendings, my colleagues, it just makes it worth it. But I just love bread and butter cardiology, chest pain, heart failure, palpitations, congestive heart disease, what causes it, broken heart syndrome. Send it to me and I like it. Where it becomes frustrating is when we get the inappropriate consults, but that's for another day. Bread and butter medicine, cardiology, love every aspect of it. But I also understand that there are some times in medicine that I do not like, cardiology medicine that I do not like. And those times it's going to happen for anybody and everybody, and not just in cardiology, but my lens is messed up. It's going to happen in any field that you go into, just the stresses of it. I'm a father, I'm a husband, I'm a son, I'm a doctor, I just try to make it to church, and I miss it, at least 2 or 3 times a month. But there's a lot of flexibilities with it that I, have to deal with and understand that this is the part of being a doctor. Y'all look at never mind. I was gonna show y'all my cat, but my cat was like, you know what? I don't care about y'all that much. What makes medicine hard? It's everything that I just talked about. What makes it beautiful is also what makes it hard, because everything that I'm talking about takes one thing, and that one thing is called time. It's time away from family, time away from friends. I can't remember how many graduations and parties and birthday parties and, life-changing events that I've missed with my friends. And, all I can tell them is that I'm sorry. But I also know that they understand that I was doing it for the right reasons. I was doing my best to help save a life. And that's the ultimate goal of a cardiologist, to implement certain recommendations and lifestyle changes to save your life, whether it's saving it financially, saving it medically, saving it from you having a heart attack, heart failure, etc. It takes time, and that time is time away from family, time away from close friends. But it's one of those things that it's well worth it. And once again, if I could do it over again, I would 100% do it the exact same way. Would I make some tweaks along the way? Yes, I would, and I guess I wouldn't make it 100% the exact same way, but the stress that I went through to become a cardiologist was well worth it, and I would do it again. And I feel like a lot of my friends who are in the medical field can't always say that, and I feel for them, because I love my job, and I'm looking forward to seeing my patients on Monday. Even though the numbers are crazy, I look forward to the stories that I hear and the ways that I can help them get to where they want to be. And where they want to be is to not see me. It's not need a cardiologist. For some patients that's going to be doable, but for a lot of them, they're probably going to need to see a cardiologist at least 1 to 2 times a year. But I look forward to the trials and the tribulations that comes with being a cardiologist. But that's just me. I knew from my early teens that I wanted to be a doctor. I feel like a lot of people go into medicine not knowing what I knew and end up quitting medicine pretty early, quitting medicine pretty quickly. I do it because I simply just like what I'm doing. Some people want to retire early, retire at a certain age. I want to be able to financially retire early, but in reality, probably retire in my 70s if I can if I can have that choice. It won't mean I'll be grinding as hard as I am now in my 70s, but hopefully 2 to 3 times a week in my late 60s to my 70s. So I love my job. There's stress associated with it. There's stress associated with every job that you have, but you just have to be willing to appreciate that stress while it's happening, but also know that it's going to be over soon, and then you're going to be happy with the decisions that you made as a cardiologist, as a doctor. So what I went through, I understand it's not going to be for everybody. Being a doctor is not for everybody. Being a cardiologist is not for everybody. I have a lot of friends who are hospitalists, internal medicine doctors who work only in a hospital, and they do it perfectly. That time away from the hospital, those 7 days off, they cherish it and cannot see themselves doing anything else. And that's the same thing with people who do shift work, things like ER medicine to laborists in the OBGYN field. They simply love what they're doing, but they love the time away and love the extended time away. But there is the benefits and downfalls of that aspect too, especially hospital medicine, understanding that you get half the year off, but you also are understanding that you're always going to miss at least two weekends every single week, every single month. So there's good and bad, and there is no perfect medical field. There is no perfect job unless you have a job where you're just getting money for living, for breathing. And if someone has found how to apply for that job, send me some information regarding it. But there's no perfect job. There's no job that you can do that you're going to say, man, I can't think of anything negative about this job. Every job has good and bad with it. You just have to be willing to be okay with the bad or the stressors of it. I won't even call it bad because they're nothing but stressors. The most stressful times in the hospital that I was just wishing for it to be over, I look back and I can appreciate why I went through that and how it made me not just a better doctor, but also a better person. It's getting a little bit chilly here, so I'm about to take this talk indoors. So, last words, any final thoughts? And the final thought is going into medicine, but also going into any job that you want to. You have to go into it for the right reasons, and the right reasons is going to be different for everyone, because we have to understand that people have different lifestyles, people have different life issues, life stressors, but this is more for medicine itself, more for, becoming a doctor, working in the health field. You have to go into it for the right reasons. You have to go into it for the reason of just wanting to help someone else out, wanting to be able to devote your time, devote your energy in giving the right information and guidance to save a life. I think if you have that as the reason as why you want to be a doctor or work in the medical field, you're going to do well. You're going to be stressed, but you're going to be willing to overcome that stress and keep going. And if you're not, you're going to be able to pivot to find if there's a special place in medicine for you, whether it's maybe the inpatient setting is a little bit too stressful. Can I switch it to outpatient? Or maybe my outpatient is too mundane. Can I switch it to mostly inpatient? So you're going to have that options to be able to do things like that, which makes it amazing, which makes medicine amazing, that it's always changing, but you can also change with it too. Your interest can change over time, and with that you can pivot and go in a different way. And I think that's one of the reasons why I love medicine a lot. It's also safe. It's a safe field. It's a field that I don't have to watch my back, that I'm going to be taken over by AI. But I can actually use AI to my benefit in helping making diagnosis quickly, more accurately, and safely. My name is Dr. Isang. If you got any benefit in this, leave it in the comments. Leave, something thought-provoking that can help people who may be going through something similar. Let me know what job you work or have worked in the past, and how you have made changes to make it work, or what you did to pivot. But leave it in the comments, and on to the next video.